Diet is one of the most common questions I get asked about with inflammatory bowel disease, and I guess what I kind of say is diets, first of all, are very difficult things to study, but there's been lots of work done trying to look at what diets might be contributing or what diets people can go on that might make them feel better. There's no one diet that has emerged as a way of preventing the need for going on medications for these diseases. So diets are usually adjunctive to taking medications. There are certain diets that are now emerging. We're learning a lot more about the Mediterranean diet being very effective at helping with symptoms of ulcerative colitis and Crohn's disease and getting symptoms into remission and under better control. No diet alone has really been shown to improve the inflammation from these diseases. So that's why I say people still need to be on their medications. They still need to follow up with the doctor. Diet is usually just an adjunct to medication to help get the symptoms under control and get people feeling better. If these diseases go unchecked for a while, they can certainly lead to complications like bowel obstruction. In some cases, fistulas can form. It puts people at higher risk for things like cancers of the small intestine and the colon. So, if we can develop a way to detect people who are at high risk for these complications or at earlier stages in the disease, or even before they develop any symptoms of the disease, like people who have a strong family history of inflammatory bowel disease, we could potentially screen some of those family members to see, is this somebody who in a few years from now is going to develop Crohn's disease, is going to be at high risk for developing complications. Maybe that's somebody we'll keep a closer eye on for the time being. Maybe it's somebody we might think about starting biologic medication earlier on in the disease course to prevent complications. I always tell the patients too, we always want to stay one step ahead. So we don't want to wait for complications to pop up before we start making changes or before we start plugging them into the GI care. Because by then we're kind of moving beyond medications into things we might have to start talking about doing surgery for. I think having tools like biomarkers that can kind of help predict the future for people and for people at risk would be a really useful thing to have. And we do have some of those tools now. I even use some now in my practice to sort of even just show patients too, like, hey, here you are. We know this about genetic markers we've detected in you and what that means for your future. And maybe it can even help convince them to start some of these medications and feel better about going on some of these medications as well.